Hello everyone. Welcome to the first installment of the Substance Use webinar series. Our first installment today is called Supporting a Loved One Using Substances from an Indigenous Perspective, with our first presenter, Tonya, who is a family peer supporter with Foundry Virtual. So before we begin, I'd just like to give a land acknowledgement. So today I am coming to you from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. My name is Paige. I'm a peer supporter at Foundry Virtual, and I'm just going to be facilitating this event, but Tonya is going to be our guest speaker for today. So thank you so much, and with that, I'll just pass it over to Tonya.
Thank you, Paige. Hello, everyone. Thank you for joining us today. My name is Tonya, and I am coming to you today from the unceded traditional territories of the Sinai and Syilx Nations. And I would just ask you to take a moment to acknowledge the lands that you are on today as well. Some of the topics I'll be talking about today can be triggering for people. I'll be talking about intergenerational trauma in the residential school system a bit. So if you find yourself triggered, please take a moment to care for yourself, or after the webinar to reach out for support, either to one of us at the Foundry or someone in your support network. So colonization has left Indigenous peoples with a legacy of intergenerational trauma. There have been many factors that contribute to intergenerational trauma. The one I'll touch on today is the residential school system. 150,000 First Nations, Inuit, and Métis children were forcibly removed from their parents and communities and sent away to residential schools. Many children never returned to their communities or returned to their culture. And many Indigenous families today continue to be impacted by the abuse and trauma that survivors endured at the schools. This results in higher rates of lateral violence among our people, suicide, substance use disorder, and homelessness. And this picture you're looking at was taken on the steps of St. Eugene Residential School on Ktunaxa territory. This is the school that my grandmother was taken to when she was 6 years old, and she stayed there until she was 16. She left when she fell in love with my grandfather, who had been hired by the school to take care of the farm animals. He'd been sent over from Holland to escape the war, and he got a job at the residential school. So they fell in love and ran away and had children, and I'm the result. Well, my father's the result. First Nations people today make up 3% of BC's population, and they account for over 16% of overdose deaths are First Nations people. To put that in the context of COVID, this time last year, First Nations people accounted for 8% of overdose deaths. And in July of this year, we were sitting at 13% of overdose deaths. Between July and the last week of October, the chief medical officer announced that it's gone from 13% to 16% in just a few short months. So COVID is very adversely affecting our people. In BC, we lose an average of 4 people a day to the current overdose crisis. And as I've just explained with the stats, the rate of our overdose deaths among First Nations people has doubled in a year. Indigenous peoples across Canada are 8 times more likely to experience homelessness than non-Indigenous people. And that isn't to say that all unhoused people suffer from substance use disorder, but it significantly increases substance use and resulting trauma from being unhoused. Some of our not all intergenerational trauma can be articulated, and the way that it was presented in my family. My grandma never spoke of her experiences in residential school. All she ever said was that she was grateful for her education. And it wasn't until she was on her deathbed that she actually started speaking to Naha again. And it was other elders in our community that started sharing stories about what my grandmother had endured and her courage in the school. And even though none of those experiencers were shared with us as children growing up, the effect of the trauma was evident in the way that she raised her children, my dad, and then the way my dad raised me. And it resulted in most of my siblings suffering from substance use disorder and various dysfunctions. And I myself fell into addiction. And it wasn't until I was on my own path to recovery that I started to question what this, hole in my heart was and what it was I was missing and why I replaced that with drugs. And as I spent time with my elders and out on the land, I realized that piece that had been missing was my culture, and it was being connected to my roots and to my culture. And so this is true for many of us when we are on the road to recovery, that reconnecting with our culture and our ways is incredibly healing. And science is always catching up to what Indigenous peoples have known for centuries, but the research is now showing that when Indigenous peoples do access traditional healing practices and reconnect with their culture, that their recoveries are stronger and their outcomes are better and they last longer. So many First Nations and many recovery models that are used in treatment facilities in BC and across our nation today are based on the teachings of the medicine wheel. And the medicine wheel is, it's not traditional for all First Nations, but for many. And so common teachings of the medicine wheel teach us that coming back into balance and bringing healing into our lives requires us to not just focus on our mental realm, but our spiritual, our emotional, and our physical realm. And we come to know that all of these things are related, and it's also known as a holistic view. So the medicine wheel teachings help us find balance in our personal lives, and they also teach us how to bring wellness to our communities. You can see from this diagram, adults and children are naturally connected from the west to the east because they are natural helpers for each other. Children need their parents and parents need their children. You'll also see that elders and youth are connected, and both stages of life, our elders and our youth are visionaries, and youth have the physical stamina and elders balance that with their mental wisdom. And it's very healing for youth and elders alike to come together and to be connected this way. And I really encourage that working with youth, that they are connected with elders. Some traditional medicines for healing substance use disorder and trauma is access to elders and our knowledge keepers, access to our traditional territories. And something that elders always taught me out on the land is that when a person needs healing, you just take them out on the land and you don't have to do anything else, that the land itself heals people. And I truly believe that is true. And I think for many of our people, they've had pavement under their feet for so long that they've lost that connection to the land. And I just think it's so important. And I encourage people just to get out on the land any way they can. Some more traditional medicines are sacred plant medicines. In particular, our 4 sacred medicines are tobacco, sweetgrass, sage, and cedar. And each one of these plants has its own medicine and healing properties. And ceremonies. Some of those ceremonies include simple things like smudge or brush offs, and also more involved ceremonies like the sweat lodge. And the sweat lodge is particularly healing for people coming through addictions for spiritual purposes, but also physiologically. The sweat is really good at moving toxins out of the body. And I had the privilege of working in a First Nations treatment center, and during the first couple of weeks of treatment, we would have about 3 sweats a week, and that really helped people to get over the withdrawals and also the cravings, because as the toxins are moving out of your body, you're less likely to crave because those levels are going down, and of course your mind and spirit are becoming more clear. So that's a really powerful traditional healing. And also reconnecting with family and community. We know that addiction thrives on isolation, and if we can come back to being connected into community, that goes so far towards our healing and the healing of our communities as well. And the most important way we can combat the harms of substance use and addiction in our families and communities is to reduce the stigma associated with substance use. And that means breaking the silence and talking about it. So here are a few ideas how to support your loved ones who are using substances or battling addictions. I always recommend to connect your loved one to cultural supports, whether that's elders, cultural healings, and ceremony. It isn't always easy if we've been disconnected from our culture. We oftentimes don't even know where to start. And especially now with COVID, it makes it very hard to connect with our elders in real time, but many of our elders are highly adaptable and are making themselves available online. So I recommend our Indigenous population in cities to access their friendship centers and find ways that they can connect that way. There are a lot of healing circles online and Indigenous run recovery circles online that people can access as well. So those are always options. And the second point is to create safe space for your loved ones to talk about their struggles with substance use. So that means not using derogatory language like calling people junkies or drunks, and making a space so that our loved ones are comfortable sharing whether they're using or not using, and understanding that they're unconditionally loved, no matter where they are or where they aren't in their recovery journey. And one of the reasons for the epidemic of overdoses since COVID is that so many people are using opiates alone, and it's highly dangerous to do so. So the more that you can open an accepting space to your loved ones, the less likely they are to use alone. And that takes me to offering harm reduction connections. So that can be something like using the Safeguard app on their phone, or connecting with community resources that offer harm reduction services or safe consumption sites, because it's so important that people aren't using alone. Another point is compassionate care. So that's providing and advocating for your loved ones to receive mental health supports, trauma-informed care, connection to community resources, harm reduction, as I spoke about, and or treatment. And this isn't always easy, navigating the mental health system or finding what sort of care will fit our loved ones. But we do have navigators here at Foundry that can help with that. And also, if you're accessing medical services such as the hospital, I always recommend that families ask for an Indigenous health navigator upon arrival, because that person will make sure that you're being taken care of and really heard while you're there and treated respectfully, and hopefully in a culturally safe manner. Another important point is to be authentic when you're talking to your loved ones, and if you're afraid or uncomfortable talking about it, to let them know that. Because particularly with youth, if we're faking it or we're lying, they know. You can't fool them. And if our loved ones feel that this is something we can't talk about it, or they feel ashamed that we're having this conversation, they're less likely to share with us. And I know it's easier said than done, but it's so important if you see signs or if you see your loved one struggling, just to bring it up, talk about it, open up that conversation. It can be life or death, the silence and not addressing the situation. So it helps our loved ones to know that we truly care and that we authentically are with them through the process. And again, isolation feeds addiction. And another point is to offer hope and to remember that as Indigenous people, we are exceptionally resilient and we have a rich history of overcoming adversity, especially when we come together and support each other, and that we have overcome so much and that we can and we do recover. And my last point is to don't give up, because recovery looks different to everyone. And for some people that might be complete abstinence. For other people that's medically assisted therapy. For some people it's a year-long treatment program. For some people it's an outpatient program. Recovery is never one size fits all, and it's not defined by any outside source. Recovery is strictly defined by the person that's in recovery. It's up to them to decide what recovery looks like for them. And it's our role as their loved ones and support to accept them for where they're at and to offer them support where they're at. And that's my short and sweet presentation. Thank you.
Thank you so much, Tonya. That was really wonderful and really appreciated learning more about how we can better support people using substances, especially from a service provider perspective, and then also for people supporting their loved ones. So thank you so much. We really appreciate it. And yes, and thank you so much for attending this presentation today. We really appreciate you coming. If you'd like to come to our next installment, it'll be happening next Thursday at 4 p.m. We are going to be having our Executive Director of Foundry talk about the future of substance use services for youth in British Columbia. So thank you so much once again, everyone. And thank you, Tonya.
Thank you.